It's not the flu. It's the 2025 H3N2K variant, and it is rewriting the rules of seasonal sickness right now. It's not just a bad cold. People are describing it as being hit by a truck, a sudden, brutal assault that leaves victims with debilitating fatigue for weeks. Welcome to Health Inside, Anatomy and Science, and today we are declaring a biological state of emergency. We are going deep inside this new strain to explain why your body is under a different kind of attack, how it's evading our immune defenses, and what you need to do right now to protect yourself in this record-breaking flu season. This is your ultimate guide to surviving the so-called superflu. Part 1. The virology of a superstrain. Why H3N2K is different. Let's be clear, superflu is a media term, but the science behind it is terrifyingly real. We are dealing with Influenza A, subtype H3N2, subclade K. The K is critical. It represents a significant antigenic drift, a mutation in the virus's hemagglutinin, or H, surface protein. Think of it as the virus changing its locks. Your immune system recognizes viruses by the shape of these surface proteins. Antibodies from last year's flu shot or infection are custom keys to old locks. The H3N2K variant has changed the lock. This means pre-existing immunity is less effective, allowing the virus to infect more people more easily. This isn't a totally new virus, but it's different enough to cause a major surge. Preliminary data from health agencies suggests this subclade K may also have an enhanced ability to bind to receptors in our upper respiratory tract, explaining the abrupt, severe onset of symptoms. Part 2. The 72-hour onslaught. A timeline of total body invasion. This isn't a gradual sickness. This is a hostile takeover. Let's map the hour-by-hour assault of the H3N2K variant on a human host. Hours 0 to 12. Viral landing and incubation. You inhale a droplet. The virus, with its newly shaped H protein, efficiently binds to cells in your nose and throat. It begins hijacking cellular machinery to replicate. Hour 12 to 36. The cytokine storm ignites. The virus has replicated exponentially. Your immune system detects the invasion and unleashes a massive systemic counterattack. Pro-inflammatory cytokines, chemical messengers like interleukin-1 and tumor necrosis factor alpha, flood your bloodstream. Hour 36 to 72. Systemic collapse, the hit-by-a-truck phase. This cytokine storm is the direct cause of your misery. High fever and chills. IO1 travels to your brain's hypothalamus, resetting your body's thermostat to create a fever, an environment less hospitable to the virus. Severe myalgia, muscle aches. Cytokines cause inflammation in muscle tissue, leading to that deep, painful soreness. Profound fatigue. Your brain is flooded with sickness behavior signals. Your body is diverting all energy to the immune war, leaving you with nothing. Gastrointestinal onslaught. Unlike many past strains, H3N2K appears to have a stronger tropism for the gut in some individuals, causing the nausea, vomiting, and diarrhea that is hallmarking this outbreak. Part 3. The long haul. Why the fatigue lasts for weeks. The acute viral phase may last 5 to 7 days, but for many, the crushing fatigue lingers for weeks. This is post-viral syndrome, and here's the biology. Mitochondrial dysfunction. The inflammatory storm can damage your mitochondria, the power plants of your cells. This leads to a cellular energy crisis. Neuroinflammation. Cytokines can cross the blood-brain barrier, causing inflammation in the brain itself, contributing to brain fog and persistent exhaustion. Muscle catabolism. The body, in its stressed state, may break down muscle protein for energy, compounding weakness. This is not just being tired. This is a measurable physiological state of depletion. Part 4. Triage and Treatment, your 2025 action plan. Facing this, you need a new protocol. The old rules don't fully apply. 1. Test within 24 hours of symptoms. You must know your enemy. With COVID-19, RSV, and this flu co-circulating, a rapid flu test at a clinic or urgent care is non-negotiable. This is the single most important step. 2. Antivirals. The 48-hour window is now a 24-hour target. Drugs like oseltamivir or Tamiflu and baloxavir or Xofluza work by inhibiting neuraminidase, the virus's escape hatch protein. With a virus this fast replicating, earlier is better.
If you test positive and are within 48 hours of symptom onset, ideally within 24 hours, demand antivirals, especially if you are in a high-risk group, under 5, over 65, pregnant, or have chronic conditions. 3. Aggressive supportive care. Hydration. Not just water. You need electrolytes, sodium, and potassium lost through sweating and GI distress. Use oral rehydration solutions. Anti-inflammatories. Ibuprofen is superior to acetaminophen for this strain. It directly targets the prostaglandins that cause fever and muscle pain. Rest. This is not a suggestion. It is a prescription. Do not push through. You will prolong the illness. Part 4. Prevention in the age of variants. Does the 2025 shot work? This is the million-dollar question. The 2025-2026 Northern Hemisphere flu vaccine formulation does include an H3N2 component. However, due to the lead time in manufacturing, it is targeted at a slightly older H3N2 strain, not the specific K subclade. This does not mean the shot is useless. Vaccination provides cross-protection. It primes your immune system with a template of the H3N2 family. Even a partial match means your body launches a faster, more robust response. Data from similar mismatches in past years shows vaccination still reduces the risk of severe disease, hospitalization, and death by 40 to 60%. It is your best shield. The new prevention trinity for 2025: vaccination to blunt severity, high-quality masking, N95/KN95 in crowded indoor spaces, and air filtration, HEPA filters at home and work. The 2025 H3N2K variant is a wake-up call. It shows us that influenza remains a shape-shifting, formidable threat. It exploits the slightest gap in our immunity and our vigilance. By understanding its precise biological strategy, from its mutated surface proteins to the cytokine storm it triggers, we can fight back smarter. We must test earlier, treat more aggressively, and protect ourselves with every layer of defense we have. If this rapid response breakdown of the superflu gave you the knowledge to fight back, please give this video a thumbs up. This is time-sensitive, life-saving information. Share it immediately with your family, friends, and coworkers. Subscribe to Health Inside, Anatomy and Science, and hit the bell. We track emerging biological threats and give you the science to survive them. Stay alert, stay protected, and don't underestimate this virus.